Okay, then just say your name.
Hi, I'm Zoe Suzanne. I'm Zoe.
And you're a senior?
Yeah, my name's Zoe Suzanne. I'm a senior at the University of Maryland. I'm a behavioral and community health major in the School of Public Health.
And I understand you're doing an internship.
I am. I'm a community outreach intern currently at Adventist Healthcare in their Center for Health Equity and Wellness.
And where are you positioned?
I'm at their support center, so it's out in Gaithersburg.
And I understand you're collaborating with the Center for Health Equity?
Yeah, I'm working with the program, the HAIR program. It's a collaboration between the Center for Health Equity and also the University of Maryland, where we go into barbershops, and it's implementing a health program. So we work with the barbers and give them different screenings and provide them with different types of health information, so that the goal is for them to eventually be able to distribute that information to their customers, so they can act as kind of a health liaison in the community.
So think back when you were in class learning
Yes.
about community outreach, and here you are now doing it.
Yeah.
What's that like?
It's actually really interesting to see everything that we've learned in class, all the community health concepts actually being implemented in the community, because you learn about it in class and you gain a basic understanding, but then actually being able to do the application of it has been really, really interesting.
Now, you're operating in black barbershops and beauty salons.
Yes. Yes.
Now, I'm just assuming that's not where you typically go to get your hair done.
It would not be, yes.
So
That would
what
be
was it
correct.
like going into those settings, looking very different than the people who are there?
Yeah, honestly, to be honest, at first I was a little bit nervous just because I didn't know how people would react to me, like a person who very obviously doesn't really belong in that setting. But I think that people have been very receptive. Everyone's very nice. They're always interested in all the health information, and they're always very appreciative of the services that we provide.
So what have you learned that you didn't know now that you're actually in the field that wasn't in your textbooks?
I think a big thing is how to interact with people in the community, because you can learn concepts, you can learn all the basic community health principles, but what you can't learn is how to deliver it. So I think it's been really interesting learning how to take the stuff we've learned in school and put it into more basic terms so that like the everyday person can understand and apply it to their life.
So you take all your theory, you
Yes.
take it and you translate. Are you learning things from the community that you would bring back to the university that might influence our theory?
Yeah, definitely. I think that the community members always provide a really interesting perspective, and we can study it from the outside, of course, but actually being able to be a part of that community and see how they perceive the community that they live in, and getting their opinions on our programs and what we can do to better them is definitely really important.
So you shared how when you first started, it was a little bit nervous,
Yes.
but now you actually feel part of that community when you go into the barbershop?
Yeah, I really do. Every time we go in, now I've been a couple of times because I've been working for a couple of months with Adventist, but yeah, we go in there and they always greet us. They're always happy to see us. So it's been really nice, yeah, being able to be a part of a community that I would have never been a part of before.
So on the clinical side, are you seeing things that give you pause? That concern you health-wise?
Like in terms of their screening results, you mean?
Yeah.
Yeah, a thing that I notice is a lot of people are smokers, a lot of the people that we screen. So one of the screenings we do is carbon monoxide, and they'll see that carbon monoxide result when we first go in, and they're like, oh wow, I didn't know that that's how it affected me. What does this mean? How can I change? And it's been really cool to tell them what the results mean and how they can use it to change their smoking habits, and we've been able to provide them with information about that. And some people have actually quit smoking since we started the program, which has been really, really cool.
And do you also help them with patches and other things?
Yeah, not me specifically, but we do have a tobacco cessation counselor that works with the program, and he can come in and provide people with patches and Nicorette gum and just other resources that they can use to help them quit smoking.
Well, we know getting people to quit smoking is an immediate health benefit.
Yes.
Any other observations?
I think that people really do take the screening results to heart. Like, a lot of people don't really exercise that much. They're in the barbershop, they're in their job, in their everyday life. They don't really exercise. But when they see their BMI results, when they see their body fat percentage results, it just gives them a measurement of how they're doing. And we've seen people be able to reduce those numbers, which has been really awesome.
That's really interesting.
Yeah, it really is.
Because they're learning this in the barbershop, not in their medical home.
Yeah, exactly.
So
Yeah.
what do you think that's about?
I think that
The barbershop versus the medical home.
Yeah, I think the difference is we come into their community in the barbershop, whereas in a medical setting, it's them coming into the doctor's office. So I think that people really do feel more comfortable when they're able to receive health information in an environment that they're comfortable with.
So you think trust matters?
Yeah, definitely trust matters.
In a trusted setting.
Yes.
Well, thank you very, very
Yes,
much.
thank you so
Last
much.
question, what do you want to do when you finally graduate?
That is a good question. I honestly am not entirely sure exactly what I want to do. I am really interested in global health and disease prevention, so I hope to ultimately pursue my MPH.
Thank you very much.
Yes, thank you.